Yep, you're good.
Okay. UNICEF states over 20 million children worldwide missed out on their measles vaccines annually in the past 8 years, creating a pathway to global outbreaks. A quick disclaimer before I begin, this speech does not revolve around the COVID vaccination, so get it out of your head that everything doesn't revolve around COVID anymore. So, vaccinations can be a scary thing. Did you know that 2 in 3 children and 1 in 4 adults are afraid of needles? The shot itself can be incredibly scary, but the outcome of not receiving a vaccination could be even more scary. To begin, what is a vaccine? The CDC states that a vaccine is a preparation that is used to stimulate the body's immune response against diseases. Vaccines are usually administered through needle injections, but can sometimes be administered by mouth or sprayed into the nose. Now that we know what a vaccination is, let's discuss why they're important and how they work. Vaccinations are important because they protect against diseases and viruses. Immunize BC states vaccines help protect you against disease without the risk of getting sick first. When people don't get vaccinated, they are risking a disease turning into a worldwide epidemic. Many people who choose not to vaccinate do so because they question how they actually work. Immunize BC states when a person gets a vaccine, the immune system responds to the antigen as if it were exposed to the actual germ. It makes antibodies and remembers how to defeat it. Then if the body gets exposed to the germ later on, the immune system can recognize it right away and quickly fight it off to prevent disease. Now that we've got the basics out of the way, I'm going to tell you why you should get vaccinated. Firstly, you should get vaccinated because vaccines are a safe way to protect your body from illness. WHO states that the United States' long-standing vaccine safety system ensures that vaccines are safe. Currently, the United States has the safest vaccine supply in its history. Vaccines would not be given out if they were not safe. Vaccines go through many rounds of testing in order to determine how safe they are and how effective they are. There can be some side effects to getting a vaccination. WHO states that the most common side effects are very mild, such as pain or swelling at the injection site. Although there may be some side effects to getting a vaccination, they are temporary and harmless. Additionally, you should get vaccinated because vaccines prevent deaths. WHO states that between 2010 and 2017, the mortality rate of children under the age of 5 years old declined by nearly 0.25%. The measles vaccine alone prevented 25.5 million deaths since the year 2000. Vaccines have helped to prevent deaths in people of all ages. Children are the most susceptible to diseases and illnesses. If they contract an illness, it's much harder for them to survive, and if they do, the recovery can be very difficult. By getting vaccinated, you are protecting yourself and others from dying if an illness is contracted. Another reason you should get vaccinated is because vaccines help to protect others. The CDC states that by getting vaccinated, you can protect yourself and also avoid spreading preventable diseases and to others in your community. Some people cannot get certain vaccinations because they are too young or they're too old. These people are more likely to catch a virus if not everybody around them gets a vaccine. They're less likely if you and all the others who can get the vaccination get it. Additionally, health.mo.gov states children who are not immunized can transmit vaccine-preventable diseases throughout your community to babies who are too young to be immunized or those who cannot be immunized for medical reasons. Exposure to any vaccine-preventable disease could be life-threatening. By getting vaccinated, not only would you be protecting yourself from illness, but everybody around you. There are some vaccinations that have been found to not be as effective for young children. So they are more susceptible to getting the illness because they can't get the vaccine. However, if people of the age to get them receive them, then the child is immediately less likely to receive the illness. Lastly, you should get vaccinated because most schools require it. cchealth.org states the DTaP, MMR, hepatitis B, and varicella vaccines are required to attend school. A majority of students who attend public schools are vaccinated. However, there's a number of children who are not vaccinated due to religious reasons. Health.mo.gov states claiming a religious exemption represents a parent or guardian's belief that the family's religious preference does not support immunizing against vaccine-preventable diseases. Actively choosing to not immunize a child by claiming religious exemption is a parent's right. However, it carries significant responsibility. To protect inadequately vaccinated individuals and the entire community, unimmunized children could be excluded from a variety of things. Refusing to get vaccinated due to religious reasons has become very overused, because in order to be exempt, there is not a verification process in order to prove your religion. Anybody can claim a religious exemption, which is very dangerous. All in all, vaccinations are important to maintaining a healthy society. I think that everybody should be vaccinated because they are a safe way to prevent illness, prevent deaths, and protect others. Without vaccinations, many children and adults would die each day. With more and more people traveling all over the world, there was more exposure to deadly viruses, which mixed with low vaccination rates can easily cause an outbreak in our country and even our own. So before making the quick decision to not vaccinate, think about how your decision could affect others. Ultimately, the decision is up to you. Are you going to help protect the world or not?